Hi, let me ask you something. If you think that our videos are helpful to you, please put something, put a like, put a thumbs up, make some kind of comment. It really helps the algorithm to bring those videos to people who are interested. As you probably know, we just came back from New Jersey Women Expo, and it was an interesting experience. We just wanted to promote or educate people in lipedema. Not sure how well it went or how many people were able to inform, because we saw a lot of people with lipedema, and really you cannot come to them and say, hey, take a look at the brochure, that's what probably we have. But we had some interesting questions actually, and that prompted me to make a video. So one of the questions is the scar tissue. Is it good or is it bad? Because traditionally we think that the scar tissue after surgery is bad, and I agree with that. However, if we're looking at lipedema, what we're trying to do, we're trying to treat the lower extremities or upper extremities circumferentially. And what we do is we create a thin layer of scar tissue circumferentially around the leg. Sort of like I would say like a fishnet stocking, something like that. Obviously, what we're trying to do, we're trying to make sure that that formation of the scar tissue is fairly uniform to the best of our abilities. And in that case, the scar tissue actually what helps to keep the legs a little bit stiffer, and what helps to keep them from excessive swelling and accumulating all the fluid. So at least in my mind, that's exactly what we're doing. And that brings me to the next point. What's the difference between liposuction that's cosmetic and liposuction that's for lipedema? Remember, we're trying to create a circumferential layer of the scar tissue, but we're trying to create it in a correct layer, okay? In the correct layer. Let me explain why. So we have the skin, we have the muscle, and in the middle we have the superficial fascia that separates superficial fat from the deep fat, all right? Majority of lipedema is located right here. Majority of the lymphatics is located right here. So when we create a scar tissue, really try to create that layer of fishnet scar tissue right at this level, not as much here. Because if we get into the upper layer, then we're at a higher risk of formation of scar tissue around the lymphatics. And if we consider that lipedema is associated with malfunction of lymphatics, now we're actually making things worse. So the biggest difference in my mind between cosmetic liposuction and lipedema liposuction, that we're trying to liposuction differently. In lipedema, we're trying to liposuction the deep layer and avoid the upper layer. In cosmetic liposuction, we liposuction both layers because the goal is just to create overall better contour. If we're trying to improve cellulite, then we're only going to the superficial layer because that's what's responsible for cellulite, not the deep layer necessarily. So when we talk about the limb-sparing liposuction, it's not the type of the equipment that we use. We use the same liposuction equipment. Yes, we modify some cannulas for the purposes of lipedema, but in reality, it's pretty much the same machine, similar cannulas. It's a technique of what we're doing. So when you talk to your surgeon, if they're not very well familiar with lipedema itself, and they do not understand the difference between limb-sparing liposuction versus normal liposuction, the key difference is, again, if you remember anything from this video, is you have to be in a correct layer. You have to avoid the layer where lymphatics are if you can. Okay, that's the key. So hopefully that answers the question. That's one of the questions that one of the visitors asked us, and per your request, we're making this video. Hopefully it explains it. I know you came back several times to ask the same question. Maybe I did not explain it well enough, and hopefully this serves as a better explanation. Again, if you think our videos are helpful, please put thumbs up, please say something, please just put a little heart or whatever. It helps our algorithms to bring the videos to the people who really need them. All right?